What about ACAM?
Well, ACAM,
Started out?
yeah, no, um, ACAM is really a
Not
funny.
to drift too much, but
No, but it's a very good question. ACAM is American Academy of Advancement of Medicine. It's a group that is teaching chelation, EDTA chelation therapy. And unfortunately, they made the mistake early on that they believed the effect of giving the chelation was that they're removing plaque from the arteries with it, and it is therefore a great treatment for heart disease. What they didn't realize is that they're removing lead and mercury and cadmium
With
and
the
toxic
plaque.
metals from the vascular system, and because of that the vascular system restores itself and gets healthier, and the chest pain goes away and your brain gets more blood supply. Also, it creates a burst of nitric oxide, which is a vasodilator. And so the basic effect of chelation therapy is a heavy metal detoxifying effect. However, it was sold with a different theory, with the wrong theory. And when Gary Gordon, one of the founders of ACAM, realized that there was a mistake, that this really was a treatment of an unsophisticated treatment of heavy metal toxicity, and he tried to introduce that thinking back into the group, he was ostracized and basically pushed out of the group because he brought a new idea to an old treatment. And then he went his own way, looking more and more clearly at the heavy metal detoxification, and created different products in that way, and and designed different ideas around that. But ACAM was the first group that actually was doing heavy metal detox on a big scale without knowing that they were doing it.
so if a parent's looking for a doctor to try some of these more cutting-edge treatments like the TD-DMPS that you mentioned, ACAM or AAEM would probably be where they'd find the most progressive doctors
Yeah.
that already know about DMPS, know the track record of DMPS, and would probably consider this topically applied version of DMPS. Would you say that's
Absolutely,
accurately put?
but never
Okay.
forget the American Academy of Neural Therapy,
Okay, yes. Your academy, yes.
which really focuses on those issues. But it's true that we do not have a group right now that combines all of this knowledge in one group. But the
We will.
ACAM doctors are very well aware of how to detox heavy metals. They've had all the lectures and have all the knowledge. And the AAEM doctors have all the knowledge about where the toxins come from and what to do about that. So those would be my two major groups that have been open to receive all this information, and most of the doctors have that down.
Just to keep it real, so these parents won't have to watch 9 hours of this if that's what this or whatever. You mentioned the TD-DMPS, and I'm going to clarify that it's TD-DMPS, which was the one that Dr. Buttar created and had the success that he's talked about, which is between 19 and 22 of these kids 100% recovered, quote unquote, from autism per Dr. Buttar. Let's go on the assumption that that's an accurate depiction of his study. How would you explain that success with basically what he did was the TD-DMPS every other day, remineralizing on the other days, some basic nutrient protocols, and some gut issues?
Yeah.
And that's pretty. So how could you, if you were to, based on what you've described, which is causal being where you really get your successes,
Yeah.
where do you feel like that falls into this whole thing?
So, to put this early on in the video, it would be for me a little bit out of context in terms of the order, because we want to first, heavy metal detox, any textbook of toxicology starts with the sentence, the rule number one in toxicology is remove the source.
Right.
Or, if you can't remove the source, remove the patient from the source. So any discussion that we have in that regard should really start with where are the sources of mercury, where are the sources of cadmium, lead, and so forth still in these kids, where is the sources of the viral and bacterial endo and exotoxins, we should really, if in terms of the order, we should just start that discussion first, you know, that people
Okay.
having a look at their home and stuff, and then look at what can we do to facilitate the heavy metal excretion.
Okay,
Yeah,
we can do that, that's
they
fine.
go hand in hand. However, because of the importance of the transdermal DMPS, I'd like to answer your question here so people see that
Okay.
early on and then hear it again later
Okay.
and hear it again later.
Just why you think, if he's accurately depicting this, then this far exceeds anybody else's success, with the exception of Dr. Amy Asko, I think,
Yeah.
with this simple
Yeah.
intervention. So parents are way curious about
So,
that.
so first of all, amongst all the currently available detox agents, DMPS has a very unique place. Yeah, it was created in the 1960s in Russia to detoxify workers in the mining industry and in the nuclear industry. And DMPS is again a sulfhydryl affinitive detox agent similar to glutathione in my prior discussion. Yeah, it has two sulfhydryl groups which bind metals and other toxins
You told me that mycotoxin.
that are sulfur affinitive. And yes, it binds very strongly mercury, lead, cadmium. It is not good for aluminum, you know, just to say one that's not binding. It has been shown, but there's much less literature available, to also bind fungal and mold toxins called mycotoxins, many of them, not all of them. And in my own experience, it is also able to bind to specific toxins created by Lyme disease and other bacterial infections.
Okay.
So, and amongst all the available agents, it is the one that has the strongest effect with the least amount of side effects. The next candidate that was created about 10 years earlier in China is DMSA. It was created in the 50s because the Chinese had a high level of early mortality amongst their mining workers in the mines. And so they created this compound to give to the miners so they would live longer.
So they could work longer.
Yeah. The trouble with all the agents is how are they applied, and we have to I'm going to have a quick discussion on that here to make it clear why DMPS is ideal. One of the problems is when you swallow an agent as a pill, it will bind mercury as soon as the agent gets in contact with any fluid. You know, the moment the pill is dissolved, it will start binding metals. So, sorry,
Got it.
fly. If the person, for example, has mercury in lining the gut, you know, let's say somebody has amalgam fillings, and every day when they chew, some amalgam particles are aerated and then travel down the gut. If you give somebody a pill of DMSA, the first mercury it will encounter will be in the gut lining and will grab the mercury. However, DMSA is a form of succinic acid. Succinic acid is used in the mitochondria in creating ATP, and so the body has a high need for succinic acid in the cells, for example in the brain. And if the brain cell is signaling, I need succinic acid, and there's succinic acid now in the gut that has just bound some mercury, because it's chemically so similar to the one the brain needs, it cannot distinguish that. The succinic acid will now travel through the blood into the brain, go inside the brain cell, and transport in its tail the mercury into the brain. You know, and this is a problem that we call redistribution, which is a serious problem that all the oral agents have. And there's two ways of dealing with that. One, choose another route of application that bypasses the gut and the most toxic places in the body and goes straight to where the mercury is supposed to be taken away from, like to the brain.
Okay.
Yeah, that's one method. Or the other principally different method is give an agent first that takes the mercury just out of the gut that the brain doesn't need. This is where my idea with the chlorella comes in. You first give a kid chlorella, it takes the mercury out of the gut very beautifully within 2 weeks, 2 to 3 weeks. It cleans up the gut of all the mercury residues that are hanging there. Then you give an agent that goes a little bit deeper and cleans up the blood vessel wall and the connective tissue around it. It's sort of cilantro and several other natural things do that. Vitamin C does that. Some of the amino acids do that. And then you give an agent that kind of cleans up the tissue all the way to the brain cells. Remember the glutathione that came out of the brain cell? Sort of that is now delivered its mercury to the front door, basically the front doorstep of the brain cell, but the mercury is still there. That's alpha lipoic acid, picks it up there and takes it away from the brain cell to the gut. Yeah?
Okay.
So the other way of working detox is to give an agents that work only superficially, clean that tissue up, then a little deeper, and then a little deeper, and then a little deeper, and do the brain last. Yeah?
Okay.
Because then when you give the DMSA, it goes in the gut, there's no mercury there, it gets absorbed in the connective tissue, it doesn't find any mercury there, it goes through to the front of the brain cell, doesn't find any mercury there, then it goes inside the brain cell, and that's the only mercury it finds.
Okay.
So this DMSA now did not make the brain toxic. Yeah? The only thing it can do is now move the mercury out of the brain.
So it's another
It's-
example of not the agent, but how the agent was used.
How the agent was used and when it was used, the sequence
Gotcha.
in which it was used. So these are the two principal methods of detoxification.